Ladies and gentlemen, welcome to MedSynapse podcast series where we explore the latest innovations in healthcare. I'm your host, Dr. Nigar, and today we're honored to engage in a thoughtful discussion with Dr. Hamidreza Rokhsatyazdy, a distinguished neurologist and MD with over 12 years of expertise in adult neurology. Dr. Hamidreza serves as a neurology consultant of ErfanNiayesh Grand Hospital in Iran and the Windsore Medical Center in Dubai. With a wealth of experience in evidence-based and cutting-edge treatments, Dr. Hamidreza specializes in a range of neurological disorders, including headache, Alzheimer's, dementia, stroke, Parkinson's, chronic pain management, cervical and lumbosacral discopathy, tremors, and various other neurological conditions. His notable contributions include a published book on awake craniotomy and numerous articles in evidence-based journals. Today, our focus is on early detection of Alzheimer's disease, focusing on the challenges in early detection, the impact of genetics on treatment plans, the role of lifestyle factors in prevention, and the promising innovations shaping the diagnosis and management of Alzheimer's. Without further delay, let's embark on this journey with Dr. Hamidreza. Welcome, Doctor.
Hi, Dr. Negar. Thank you for having me in this discussion, and thanks from MedSynapse group. This is our third, I think, podcast that we are recording, and it has a good feedback from our patients and our audience. Today I think the topic is about Alzheimer's disease. I'm at your service to answer you and your followers' questions about the Alzheimer's disease.
Thank you so much, Dr. Hamidreza, for being part of MedSynapse family, as we're continuously having very interesting podcasts together.
Thank you very much.
Now, let's begin with our podcast. Dr. Hamidreza, the first question is, what are the key challenges in identifying Alzheimer's at an early stage, and how can healthcare professionals overcome these obstacles?
For diagnosis of Alzheimer's disease, there are two main parts. The first part is to understanding and distinguishing the normal aging process from the Alzheimer's disease. You know, like other parts of the body, when you are getting older and your age grow up, for example, your muscles getting weak, your walking may be slower, your brain may be work slower. But it not means that you are diagnosis Alzheimer's disease. The important thing is to distinguishing this normal aging process and normal slowing of the brain from the start of the Alzheimer and MCI, minimal cognitive impairment, because previously. Because we don't have any drugs for treatment of Alzheimer's disease, that was not issue. Because if you understand, for example, it's earlier stage of Alzheimer's disease or normal aging process, there is no difference. You don't have any special treatment, just for drugs that it's used in the moderate to severe Alzheimer's disease, and you couldn't use it in the mild or early symptoms of the Alzheimer's. So it's not make sense to go through this challenge. But nowadays, as this anti-tau proteins, monoclonal antibody, and anti-synuclein antibodies, they are the proteins that destroying the neuron cells. These drugs are focusing on treatment of the Alzheimer's disease in the earliest stage. So distinguishing between these two now is valuable, because you have a treatment for Alzheimer's disease and you don't need to give the normal patient these drugs. And these drugs also, because they are new and monoclonal antibody, new technology, it's very expensive. So this is one of our challenges, that nowadays, as there are growing many drugs to treatment early stage of the Alzheimer's disease, to distinguish between normal aging process from the Alzheimer's disease. The second of all, the complexity of the brain tasks and brain works. It's very important because, especially in the patients who are very smart and alert, you couldn't understand this delay of the working of the brain or decreasing the rendement and the function of the brain. Why? I'll give you an example. If a runner, professional runner, run 5 kilometers, it's for example 15 minutes, in 20 minutes, in 1 hour, it's, you say, oh, he's running very well. But in comparison of the previous talent of his, that he could run 10 kilometers, now he decreased. But he is now over the average. But he has a 50% decrease in the function. It's about the brain, like this. Who has an active brain activity? When the Alzheimer process started, they are coming to the 50% of the function of the brain. So now they are above the normal patient, above the normal people, but they decrease 50% of the function. The function decreased. So distinguishing of these cases are difficult too. And we have also many exams for evaluating many parts of a brain, but it needs to take time or repeated in a various times so we can detect this decline and decrease in function. The other important thing is brain has near 32 or 35 tasks. One of the tasks is memory. In Alzheimer's disease, specifically, the memory destroyed. But in the other hand, in the other neurodegenerative disorder, we name it dementia, the other part of the brain also lose their functions, such as frontal lobe, parietal lobe, temporal lobe, occipital lobe, or cognition, any perceptions and executive function of the brain. They are all of them together start to decrease their function and start to lose their function. So maybe when you test the memory, that memory is working well, but the other part of the tasks and brain getting they're losing their function. So it's important to examine other tasks of the brain.
Thank you so much, Dr. Hamidreza, for highlighting and sharing with us on how we can identify the Alzheimer at an early stage. Now, moving on to our next question, could you please discuss the role of genetics in Alzheimer's disease and how understanding a patient's genetic profile may influence the treatment plan?
There we have many genetic tests that predict maybe from the young age that you are in the risk of having Alzheimer's disease or not, or you will, when you have any history of the first degree siblings that they have in the early ages of the Alzheimer's disease, for example in the 15 years old or 14 years old, you may have this genetic disorder as well. So it's very, very important in that cases to do this genetic study and genetic test. But in the normal individuals without having these kinds of history, doing the genetic test previously was not very sensible. But nowadays it's makes sense because as I mentioned before, nowadays we are going to find many treatments in the early stage of the Alzheimer's disease. But the most important than genetic study, they are blood tests that detect a specific subtype of tau protein in the blood that we can predict more and more accurate from 10 to 15 years earlier to understanding the Alzheimer's disease and start the treatment also. But we don't start the treatment in the early stages because we need to have and to establish some evidence that the brain works functions are losing and decrease. So it's very important to have a decline in the brain function, and brain tasks are get impaired. So it's very important to do these tasks function and brain task test to understand the function of the brain. But nowadays there are many role instead of genetic study, they are going through this detecting these biomarkers on the blood or CSF to detecting earlier sign and symptoms of the Alzheimer disease or other neurodegenerative disease, dementias, like as Lewy body dementia, frontotemporal dementia. There are many various kinds of dementia, but they are not Alzheimer. Alzheimer is the specific kinds of dementia that affecting the recent memory. The other subtype of dementia, such as Lewy bodies or frontotemporal, have the other sign and symptoms that I don't want to mention them because go through them because it's have many details, specific and special details that it's not useful for the audience. But nowadays, what is most important for us, they are these biomarkers than genetic tests. But genetic test has their role also in diagnosis earlier diagnosis of the dementia. It has a specific role.
Now, how about lifestyle factors such as diet and exercise? Do they play a role in preventing or delaying the onset of Alzheimer's? And if yes, how can healthcare providers integrate this knowledge into the patient care?
Brain, such as I always said, brain like muscles. When you get use these muscles, they are always powerful. When you don't use it, it's get atrophic and it's useless. So brain, it's need to be work, and you need to educate your brain to making new synapses. In the brain, there is no any importance of the, for example, size or number of the neurons that you have in your brain. It doesn't matter. The main important things is the circuit and the interaction of the neurons. As much as you have more interaction and more circuits in your brain are more powerful and healthier. And it didn't, because it has many ways to interact these neurons. So if one of these neurons destroyed or dead, the other cover its work, because all of the other neurons are healthy and smart and fresh. How you can increase the ability and function of your neurons? It's by the using this neuron. The most volume of the neurons are working in our perception and movement. Less neurons are working on the memory. Always asking me solving Sudoku or memorizing poems or learning new languages, they are helpful. Yes, they are helpful. But it just work on a specific part of brain that is not so much. But when you going to learning an exercise or a sport or something that has rhythmic like dance, new professional dances, because your hearing is involved, your balance is involved, your cerebellum and brain stem is involved, your motor system involved, your sensory system, deep sensory system, your eye and vision involved. All of your systems involved in dancing or in the sports such as tennis, because you need to look at the ball, and you need to coordinate your body to have a good backhand or forehand, because you must be in a specific position and specific points in the court that you can hit the ball correctly. So it's all of your part of the brain, such as balance, vision, auditory, motor, sensory, all the parts of your brain cortex are involved. we need to learn something like this that involve all the parts. So exercise, and we told the patients do the new exercise. Don't go through the routine program. Each 4 weeks or 6 weeks, change their programs. For example, the sport at the gym, for example, you're flexing the elbow or extending the elbow, biceps, triceps, for example, quad flexion or extension of the knee. These they are routine exercise. It doesn't involve any part of your brain, just make you powerful, and it's effective. But if you use this, if you strengthen your muscles through new exercise, that your balance get involved, that you need to train this exercise to remember how to do it, it's more effective on your brain than a normal exercise. But the normal exercise is better than be steady and don't having movement. Either walking, fast walking is much more effective than anything. But if you want to do something superb for your brain, but in the old ages or in the ages of the 40 or 50, the patients must be aware of the sport injuries, because the sport injury is very bad and the healing process is decreased through these ages. So they must do this exercise under observation of the talented coach. But the exercise is very important. About the diets, there are many. There are 4 various type of diets. For example, chocolate, dark chocolate, berries like raspberries, blueberries, and the fruits that have a red light. They are very helpful for. They have neurotoxin, neuroprotective effect that decrease the toxin of the neurons and make them healthy. There are some Indian supplements such as Brahma and ashwagandha that help improve the neurons ability and functions, and they are neuroprotective. They are very helpful. And having a healthy Mediterranean diet, that's very recommended for protecting the brain from the stroke and Alzheimer disease. And also, especially in the patients who are suffering from diabetes, hypertension, and hyperlipidemia, we are strongly recommend them to tight control their metabolic situations. And smoking cessation is very important. Also, don't using a small part of the alcohol, because the alcohol is the cytotoxic and killing the neurons. A small usage of the alcohol is bad for Alzheimer disease, so we do not recommend at all using alcohol, and we says and recommend to cessate it completely, like a cigar and nicotine. They are the main important things about the lifestyle that comes to my mind, and they are the more important points of the view that I think it would be helpful for your audience.
Now, coming to our final question for the day, Dr. Hamidreza, in the world of technology and innovation, what promising developments or tools are emerging for both diagnosis and management of Alzheimer's, and how can healthcare professionals use them effectively?
About the diagnosis, there are many new AI techniques and systems and computer-based examining that we can examine and evaluate many tasks of the brain, and also monitor them if these taxes decline, understand it immediately. And also, on the other hand, for example, if the patient has suffering from the loss of concentration, loss of memory, loss of, for example, attention, we can increase and exercise the brain by these methods to enhance these parts of brain tasks. So we have many AI and computer-based tests and also exercises to detect and enhancing the problems of the brain task, all of the brain tasks. On the other hand, there are now that I'm talking to you, there are 400 drugs that they are going through their clinical trial for treatment of the Alzheimer's disease. If we are not be optimistic, 1% in 10 years, if 1% of these 400 drugs in 10 years can get the FDA approval, that it's not impossible, it is possible. It means that in the near future, we have 4 new drugs for controlling Alzheimer's disease. Nowadays, we have 3 new drugs. 4 of them are previously used for many years. Now there are 2 monoclonal antibody, and in the future, I think this monoclonal antibody would be increased, and we have a better options. I think one of them will be get the FDA approval in the near future, I think in 2 or 3 months later, and it's very safe that we can use for the MCI and early stage of the Alzheimer's disease without side effect, without any major side effect. So it's very safe and it's very helpful. So detecting the Alzheimer's disease in the elderly and early detection, now it's become important. Previously, I told you, because we don't have any drugs, the early detection doesn't make sense. It's just wasting of the energy and money. But nowadays, the importance of early detection of the Alzheimer's disease and MCI is very important. And we have many ways to establish the diagnosis. One of them, they are brain tasks evaluation. The other one is QEEG, analyzing the brain waves. Brain perfusion techniques such as CT perfusion and MR perfusion techniques. CSF test for the beta amyloid and tau proteins, and also serum biomarkers such as the P subtype of tau protein, and also genetic study. There are many facilities that we have, and with this checkup, we can predict more than 99% that the patients will have Alzheimer in near future or no. It's just a normal aging process.
A heartfelt thank you to you, Dr. Hamidreza, for sharing your wealth of knowledge and expertise on Alzheimer's disease with us today. And thank you so much for your passion for advancing in neurological care.
Thank you very much. Thank you for you, Dr. Nigar, and also the MedSynapse group for having this discussion and getting this platform to inform the patients and also healthy individual to protect their health, the first step, and then the second step to understand how to prevent important or disabling disease such as Alzheimer's disease.
Thank you so much, Dr. Hamidreza. Your dedication to the field and commitment to improving the lives of those affected by Alzheimer's is truly commendable, and we're definitely looking for many more sessions together.
Thank you very much.
And to our audience, your engagement is crucial in the pursuit of advancements in Alzheimer's care. Thank you so much for joining us in the ongoing conversation. Until next time, goodbye.